Good morning, everyone. Sorry for a little technical delay. This is our first virtual clinic, so we're trying to get this going. So at this time, I'm pleased to invite another one of NAWC's partner and the national thought leader relating to evaluation of health benefit tools. We've got Joe Van de Graaf, who's Vice President of Digital Health and Security for Class Enterprises. Joe serves as the Research Director in the payer and employer areas for Class in Provo, Utah, and he leads Class's relationship with NAWHC for its comparison of clinic vendor capabilities. At this session, we're going to be talking about how to create good partners for your Worksite center. So Joe, I'll turn it over to you.
Wonderful, thank you. So good afternoon, everybody. Nice to be with you virtually. I wish it were in person, still adjusting to this new world. And I don't know how long the new world will stay new. Maybe it just becomes the norm, but glad to be here and share with you thoughts, insights from research that we've done as we've talked with employers and as we've talked with service partners in the world that we refer to as worksite or near-site health, or health centers, on-site clinics, near-site, sometimes remote clinics. And as we talk today, the theme is how do we partner for success? How do we create and maintain relationships between employers and vendors for on-site, near-site health centers that move us to where we want to be, to have better outcomes, better health, and actual as well cost savings. So a quick introduction for let's see, let me move this. Quick introduction so you know who Class is. We are a research organization focused 100% in healthcare, and our work is intended to create transparency in the market and help healthcare be delivered better. So we look at the technology and services that are purchased in healthcare and answer this question: how well are they working? And sometimes that's really that they're working great. Sometimes that's the exact opposite. And sometimes it's in the middle. But our mission is to improve healthcare, and the research we do and the data that we will show you today comes directly from research interviews with employers. Some of you actually may have contributed your voices. And although we don't name organizations, employers, and clients, you may recognize comments that you've shared here. So we are the voice, if you will, the voice of the customer in the worksite health market. We do about 25,000 research evaluations each year, and that's not all an employer. We are in the provider market and the payer market as well. But excited to talk to you today and share with you results of our research as we look at what is happening here. So for a quick roadmap today, and I believe we've got about 30 minutes, maybe 25, and I want to make sure we have some time for questions at the end. What is happening here in 2020? What has changed, and what does that mean for us? Second key topic is how do we love the clinic, and how do we measure it? And this is a big question for employers, where we often love, and employees love, having an on-site clinic and health center and benefits, but how do we actually measure value? And then third will be success factors for both vendors and for clients as we partner for outcomes. So this is this all comes from our research. It's a snapshot in time, limited over the last 12 months. We speak with usually about 100 to 200 employers each year and ask, what is your experience? This is a snapshot of the last 75 or so research interviews showing what will my experience be. There are a lot of different vendor partners in this market, more choices than there have been in the past. And if you were to, so to speak, roll the dice based on whatever solution provider, or I should say services partner you go with, here is overall what employers have shared with us the last year. So you see the distribution actually pretty healthy. On the right-hand side, a lot of employers, I should say, are very happy with the clinic, the vendor who they partner with. And then if we were to add together all of the scores you see on the left, we call that the angry tail at Class, anything below a 70, which is really, I'm not sure, I wouldn't do this again, I'm ready to replace. So this is a healthy overall distribution for a market segment. We measure 100 or more different market segments. So I want to give a big picture. If you were to start today, what is the likelihood of how satisfied you would be? Specifically, as we look at what is happening in 2020, backdrop to the research we do. The research evaluation that we do is not technical in nature. It is not scientific in nature. It is conversation in nature. So I speak with you as an employer and say, how is it going? What are you seeing? What are the outcomes? How do you plan to continue with your service partner? So the data that we have comes, and the ratings that you will see, some of which are all anonymized, by the way, across vendors. But that is the backdrop to our research. We recognize there are other choices. Some employers may prefer to do this on their own. Some do. Some may actually partner with a kind of local health system. But what we currently evaluate are the independent, standalone, third-party service providers. With that in mind, although we won't be going specifically into any of these service partners, we do measure a number of them. And we do have data. So if you might be interested as an employer to have access to that and participate with us, you're welcome to connect with me offline. So biggest trend of 2020 is, as you know, COVID. And I don't know if that's a trend, the biggest challenge, but the immediate rise of telehealth. And what's fascinating here is that what we as an industry have been working to put in place for quite some time, the front door got opened so quickly. This was from a research interview with an organization who said we had launched a 5-year plan and we accomplished it in like a month. And that's not uncommon for what we're hearing, where telehealth it has risen both in demand and in popularity. And popularity, you might even say just necessity. We anticipate that this trend is here to stay by way of telehealth. So as we look at research we've done, prior to COVID-19, actual adoption of telehealth is fairly anemic. Over the last 3 to 4 months, and particularly around May, June timeframe, it's skyrocketed to where 1 out of 3 or almost 3 out of 4 or more of what might be a typical visit is being done virtually. And as we look to the new norm, we anticipate somewhere from 10 to 35% of, in whether we call them encounters or visits, are going to be done virtually with telehealth. So this will change the industry. A couple learnings as we look at COVID-19. One is that most vendor partners, and you may have seen this with your own clinic provider, did something to help. So we spoke with, and this isn't just clinic providers, this is other vendors as well, but we spoke with over 100 different solution/service providers. Over 90 of them actively engaged, provided something, created reporting, some kind of free resource. So this is a healthy testament to the industry of healthcare and of how we are trying to both adapt but also help. A couple other key learnings as we go through this is virtual delivery is likely to stay, and virtual training and virtual engagement are just here. And this is the way of the future and the norm. And what we have learned is that both on the vendor and the client side, there's both willingness, appetite, and even necessity of we need to find ways to do what we've been doing quicker, faster, easier, and virtually. So these are things that we anticipate will stay. Beyond just telehealth, wanted to highlight maybe 5 or 6 other trends that we are seeing in the market. One is that on the vendor side of things, third-party service providers, we have seen consolidation and M&A activity over the last 12 to 18 months and anticipate that will probably continue. Second is, and some of you as employers may feel this, or you could probably say this far better than I get to talk to a lot of you and we get to share this story, but if you are going the second time around with a clinic, you are much more educated, you're much more thoughtful, you're much more prescriptive about what you need and how even you write a contract. We're seeing more healthcare organizations, whether it's hospitals or health systems or even payers, who are starting to offer services or who are trying to do more. The need for mental health, and I think it says mental health coaching and services are on the rise. Shared health centers. So the mode of delivery for a clinic it may not be best to just do it on site anymore. It may be we do this virtually. It also may be we're seeing in the market that there are vendors who are establishing call it community center type clinic, and then looking to bring employers in versus just maybe what the traditional we are going to build or use existing infrastructure to put the clinic in place. Return to work. How do we return to work safely? When is the right time? How do employers manage this? How do employees feel safe? What are appropriate initiatives and checkpoints as we do return to work? And then another trend, and this is a little bit of a example of just pain and drama, where overall, as you remember the chart we showed a little bit earlier, where what is likely my experience to be, the scale we use is a 1 to 9, and it's not 1 to 10, because with 1 to 10 actually there's no middle. I don't know if any of you ever thought of that, but if you're giving your vendor a rating of a 7 or an 8 or a 9, that means that you're usually in pretty good hands. However, where on-site clinics have not worked and where vendors have not delivered well, the experiences employers have are very painful, and they're very cultural as well. It's very difficult to start with a new service provider if the previous experience, if your team members, your employees as an employer had previously poor experiences, that can be very hard to overcome. Moving on to how do employers and vendors, how do we love and actually measure the value of the clinic? And so this is an actual quote from an employer with whom I spoke, and by the way, our research interviews are phone-based, most of them. We prefer to do that versus online. We find better stories and more understanding. This is often how an employer will start the conversation. I love the clinic. My employees love the benefit. It's been a great thing. And then a statement follows, I just wish I could actually prove the value of it to the CFO. So this is industry benchmarking. So keep in mind, at class, we measure around 600 to 700 different, whether technology or services in the world overall of healthcare. And in work, we refer to as Worksite Health. These are employer ratings on their service partners for money's worth. So this reflects the challenge that we just talked about here, which is I just wish I could prove the value. So at an actual money's worth, according to client perception and value they see associated with money's worth, we're actually at 29th percentile here as an industry. And a great opportunity for us to figure out how do we better measure, and improve is maybe not the best word, but how do we measure and evangelize is probably the word that I would prefer to use. So other areas where we do research, here's an example, and this came from a discussion I had with an organization just about 3 weeks ago, and the discussion was not on Worksite Health, it was actually on security technology. And this leader brought up these were their words. It's like the money's worth thing, the value. It's like security. You get what you pay for, and what you pay for, you don't know what you get. So in the world of security, you know the value of what you have when you're breached. No, you know when you're not getting breached, but then it's hard to actually assess that value. Similar to insurance, like you have car insurance, maybe life insurance. The value of that matters most when you need it the most. So taking this concept, how do we create, show, and measure value in Worksite Health so that it's an ongoing thing, not just not the insurance or the security concept. As we talk about this, a few things to recognize. One, this is really hard. This is really hard. There are, as you talk with your vendor partners, you might not be surprised that they have an actuary or multiple actuaries who work with you or who are going through this data. This is a difficult thing to really measure and to understand how to do it. There are a lot of different approaches, but this is a typical comment that we will receive from employers as we talk. There are reports, but I would like them to be better. I need to know much more about how what we are saving. Another example from what employers have shared with us is, you know what, our vendor's transparent, but it's just not quite what we're looking for. I'm looking for kind of slightly different data. I'm not dissatisfied. And they're not holding something from me, but it's not quite what I'm looking for. And this reflects what I will call the radio tuning need. So I guess we don't really tune radios that often anymore. We all use other technology, but for those of you familiar with that, should be all of us, the idea of barely tuning the knob on the radio can completely clarify, or it can completely ruin your what you're listening to. And that's a similar concept as we look at reporting. So here's an interesting comment from an employer we spoke with who says, our vendor does a good job telling us what they deliver, but we don't understand the financial impact. And this isn't something that is in any way malicious, but it's a common need and concern and question that employers have of how do we understand the actual financial value. So here's an example of utilization reports, which is one way that some vendors address this. So there's an employer comment, hey, we've questioned some of those reports. They actually say that we have 100% utilization, but we know we're not having all of our people go to the clinic. So this represents a differing view from what sometimes a vendor partner will say or track versus what employers believe and see and track themselves. So we have disparity often in these things. Flexibility becomes a really important aspect for what employers are looking for, that idea of turning the knob and tuning to me. Our vendor needs to be more responsive as when we as clients are making changes and requests. Another concept and thought here, interestingly, there tends to be a lot of laser focus on, and I don't know if ROI is the best word, but we're going to use ROI here, on value and ramp up and onboarding in the first year, and sometimes even beyond, to get a on-site clinic or near-site clinic or even remote going. It takes a lot of engagement. As you probably know, with other health benefits, they although they are there, they don't just naturally improve or change health. This requires engagement. So this was from an employer with whom we spoke. They mentioned that, hey, I thought they instituted an annual review. I thought they did a really good job the first year as we worked with them. What becomes more important and sometimes harder is tracking year over year, given that employees we have sometimes are transitioning, or we have turnover or other factors. And that relates to how this is kind of hard to tackle science, as we had talked about earlier. Another thought to share here, reporting and measuring the value is not just a one-time thing. This is an ongoing variety, really, as if an employer and a vendor partner together can identify what the employer is looking for, how they measure it. I've talked with employers who, for example, would say, my vendor came up with a whole bunch of reports and metrics, and it was nice that they did, but it didn't align to what we really wanted to know. So we would say that that is a really important part of what employers are looking for. Now, as we dive into, as we talked about the both challenge and feedback that we see hearing from employers about measuring the value, and again, this is something where we usually, as employers, are very excited for this benefit. It took a lot to get it in place. We just need the value. We just need to measure and prove the value of it. So what are success factors that vendors and clients together can work on? And as we go through this, some of you may have a vendor partner today. Some of you may be considering. Some of you may be doing this on your own, or some of you may not yet be doing it. But these factors should be applicable to vendor and client relationships, or even if you look to do this on your own. So first is alignment and fit, scoping. What do we have? What do we need? What do we contract for? Second is utilization and adoption. And this is true for any health benefit. If it's not used, if it's not adopted, then the value is going to be much less. And then we will revisit what we talked about around financial value and outcomes. So first, on alignment and fit, best practices for vendors. One is identifying and tailoring what the services are, and not just once, but each year. Now, let me share a quick thought with you. At Class, like I mentioned, we do tens of thousands of research interviews, and we measure hundreds of different vendor services and products. Typically, what happens is the more prescriptive, the more designed, the more, and cookie cutter is probably not the right word, but the more a vendor knows their client, and the more prescriptive that they can be, and the more that they can standardize, that tends to produce success. As we started doing research in this market a few years back, I heard a number of times, if you've talked to one client, you've talked to one client. Every client is different. My initial reaction to that, based on all the other research that we have done, was that sounds very atypical. We're believers. What employers need may be very specific to size, may be very specific to even infrastructure, but aligning each year and understanding. What doesn't help is underscoping, or if a vendor knows what their client needs and doesn't scope the agreement and the services to match what really needs to move success, that would not be a best practice. Resources from the vendor who are culturally aligned. I can tell you, I've had research calls with employers who will, the first thing they say, we have had the same physician or nurse practitioner for 5 years, for 10 years, for 15 years. They know us, they're part of us. That's really what we're looking for. And also, on the contrary, when an employer is really frustrated, often it has to do with there's not the right cultural alignment with usually caregiver, but sometimes administrative resources. And then third, on the vendor front, is honesty and transparency. What is working and what's not? One of the best signs of a successful partnership is the willingness to not only ask, are we doing well, but to proactively suggest, I don't think this might be working right. What is your feedback? We've seen it work better in other places. And then with employers, willingness to learn what models are most proven. And as a client, as you consider who you contract with, one of the most important things for you is knowing that you can create success with this. And second is a firm commitment to embrace the clinic and services. This takes a lot of focus, it takes a lot of engagement, and it's not just a one. So there are lunch and learns, there are programs, there are flyers, there are health fairs, there are a lot of things that can be done. Employers who do this in an ongoing way tend to be, meaning embracing the clinic and the concept, tend to be more successful. And then candor as well. If your vendor partner has a gap, discuss it, ask about it, highlight it. Usually in this market, probably 8 times out of 10, maybe 9 times out of 10, employers can receive the help that they need. So,
no, you've got about
this,
5 minutes to go.
Thanks, Larry. So we'll finish quickly here. So quality of staffing consultants, this is data, actual ratings from employers. This shows actually that we do really well. So we showed you the money's worth on 29th percentile. We're in a much higher percentile in this market of how well we tend to align culturally. Maslow hierarchy of needs, the class hierarchy of needs, worksite help. We need to have the right resources in place. And do so consistently. Second, we need to have adoption. Third is financial value, and fourth is strategy. And as we look at, and we talked about this, if you've seen One Health Center, you've seen One Health Center. How do we do this? This was last year before COVID hit, before telehealth. This would likely look pretty similar this year, except for telehealth would probably be 50 to 70%, maybe even more. These are the services that are used. So most everybody is doing primary care and some kind of wellness coaching. And then as you see these other services, some of them are much less common today. Utilization and adoption. We're given the time, we're just going to focus on this first one here. The best practice for the vendor and the client is the same. Meaning assume that nothing is going to happen unless you encourage, plan, and activate it. And if both the vendor and the employer are making that assumption and driving towards it, that will be a very healthy roadmap for success. And by the way, the reality is we all have jobs, we all have other things. We go to work and we spend more time there. And this is not atypical where, for example, an employer might say, I wish we had better utilization, but we're not requiring our folks to go. So this could be a great opportunity. We talked about materials and health fairs, new hire orientations to get adoption and utilization moving, and then success stories. If your employees are having success stories, if you're seeing them, shout them, share them, make it real, make it personal. Okay, financial value and outcomes. We spent a good amount of time on this. A few key concluding thoughts. One is measuring just one thing may be good for one employer, but assuming that that same thing to measure works for other employers is not a best practice. So identifying what we're measuring and how we're measuring. And there are in here a number of other client comments of what is working, and at risk is a new approach that we're starting to see. So where do we start? This was an employer we spoke with who indicated, you know what, there are a lot of things that you can do, a lot of fitness related things, but really one place to start is we need to assess, we need to do these screenings, and we need to use that as a start. As we look going forward in this market, these are some of the themes that we see as most important for employers: figuring out the value piece, measuring it, and then how do we not only gain adoption, but how do we encourage that? And these are all elements that we have seen lead to successful partnerships. So with that, let's open up for questions.
I'm sorry, we just don't have time in this virtual environment. We're kind of stuck. However, you've got Joe's email address there. Class is a class act. It's a wonderful resource. It's a great knowledge base for employers, and I would strongly encourage people to learn more about it. In fact, as Joe just hinted, if you go to the class website, you'll find they have a plethora of reports on all types of health benefits. But Joe, thank you very much for your time here. We look forward to working with you in the future. And again, this session has been recorded and will be available along with the slides. At this time, I would ask everyone to sign off and come back to our next session, which is about our innovative employer focus on Rosen Resorts. Thank you very much. Bye-bye.